Jeremy, get the door. We're here. We're here. I knock.
Hi, welcome to Texas Tech University Home Health. How can I help you, ma'am?
Well, she's been having trouble breathing, and whenever she walks more than 5 feet, like she gets like this.
Okay, I'm gonna just
Stand straight up, Mama.
fill out this questionnaire.
Expand your lungs. So what am I supposed to do with this?
I just need you to fill that out, sign it, and then you're gonna go to the waiting room. It's gonna be to your right.
And then I'll just bring it back to you?
Yes, when you're done, you can bring it
All
back.
right. Thank you.
Do you have experience with shortness of breath on exertion?
Yes.
Okay.
Yes.
And how long have you had that?
Oh my gosh, like 5 years or so.
5 years. Oh my gosh. When walking up, how many flights of stairs?
Oh
you
my
can't
gosh.
get up any one flight.
No, not even
Okay. After walking, how far?
half
Just-
a block or so.
Okay. And shortness of breath, does it occur at night too?
Oh
When you're
yes,
sleeping?
yes.
Oh my gosh, okay. Cough, sputum, bloody sputum.
Yeah, just coughing forever.
Okay, yes. Does anything come up with it?
Sometimes.
Okay. Do you sleep on a lot of pillows?
Of course, son.
Okay. Do you have any difficulty breathing from asthma?
Yeah, they said
You
I
have
had
asthma,
asthma
right?
like
Yeah.
5 years ago. Just because I cannot stop smoking. I like to smoke.
Well,
They better not tell me stop smoking. I'm not gonna happen.
we'll see, Mom. We'll see. You shouldn't be smoking. I don't know what emphysema is. Bronchitis,
Well,
COPD.
well, this is what I say, but I don't believe them.
Okay.
I think I follow
So
it.
no. Sleep apnea. Do you snore?
Oh my gosh, how dare you, son? No, of course not.
Okay. No. Get this to them.
We got it done.
Okay, thank you. You can go have a seat. We'll be right with you, okay?
All right.
Okay. Hey, Margie, how are you?
Hey, let me tell you. Oh my gosh. I've been out on a date. I'm never gonna see him again.
Oh, that sucks, girl. That sucks. Okay, so we have a new admission.
Okay.
She has a history of COPD and she has shortness of breath when she's walking. Her 2 sons are with her.
Oh, she's probably traumatizing. I don't know.
Maybe. But her 2 sons are with her and they said she's been like that when she started walking.
Really?
Mhm.
Okay. Well, I guess let's put her in bed 5. Call Myrna. Or I don't know. Where's Myrna? I don't know. Hey, Myrna.
Hey,
We
hi.
got a patient.
All right.
Finally, I found you. I was looking for you everywhere.
I've been here all day.
Okay. There's a patient. Can you please take her to bed 5?
Okay,
And
sure.
then take her vitals. She's
Sure.
out of breath.
Hi, how are you?
Oh, no, you.
Oh, I'm sorry to hear that. Okay, so my name is Amy. I'm a medical assistant, and I'm gonna help you. Okay? Let me just take you to the room so we can take your vitals.
Where's your brother?
I think you stepped outside.
Okay, comfortable?
Yes, thank you.
Thank you. Okay, so we're gonna go ahead and sit you out in bed, okay? So I can take your vital signs.
Oh, they're kind of high. Where's my mom gonna fall out of it?
No, we're gonna just make sure she's comfortable and she's safe right here, okay? Ms. Marisa, it seems like your oxygen it's a little bit low. It's at 85%. So I'll go ahead and notify.
So you think I'm on diet today? I'm not planning today.
No, not
No.
exactly. We're gonna go ahead and
Not
take care of
exactly. Meaning you say I have a lot of chances.
that. No, you don't. We're gonna go ahead and help you, okay? So I'm
Okay.
gonna go ahead and notify the nurse and the nurse practitioner so that we can help you.
Okay.
All right?
Thank you.
Go ahead and lift up the head of the bed a little bit so that it can help you with your breathing, okay?
Thank you.
Okay. Dr. Carrillo.
Hi.
Hi, we have a patient in room 5. She's having difficulty breathing. Already took her vitals. She has a blood pressure of 135 over 96, heart rate of 102, oxygen at 85% room temperature, and a temperature of 98.5. Her respirations are at 24, and I sat her up in bed so it helps her breathe.
Oh, okay.
Okay?
Okay. Margaret, can you get the ABGs for me, the CBCs, and then can you also put her on 2 liters Vienna's cannula for me, please?
Got it.
Oh, and can you give her some water?
Sure.
Okay. Hi, Miss Maricela. Hello. How are you? My name is Margie. I'm gonna be putting you on oxygen. 2 liters. And here's some water. Okay. This oxygen is just so you can breathe easy. Your O2 was very low. It was at 85 oxygen in your body. Okay. So we're gonna hook you up here to 2 liters. And then also I'm gonna have to draw blood. Okay.
Oh, Mom, I can't see you like
It's okay.
this. I gotta get out of here.
Real quick.
I'll come back later, okay?
Okay, son.
Okay, got it.
I'll stay
Got
here,
it.
Mom.
All done.
Thank you, son.
Love you.
I love you too.
Hi, hello. Hello. Hi, my name is Carla. I'm the nurse practitioner here at the unit. How are you feeling today?
I feel better.
You're feeling better? That oxygen is helping? Oh, okay. Is it okay if I hear your lungs rolling? Okay. You take a deep breath in it. Okay. Do you mind if I check the muscle from the back? Another deep breath.
Thank you, son.
Just breathe normal. Okay. Okay, so what we're gonna go ahead and do next, I'm gonna go ahead and order a chest x-ray, okay? We're gonna go ahead and put that order with radiology so we can see exactly what's going on. But for right now, it seems like you might have COPD, okay? Do you know what that is? Okay. It's a chronic obstructive pulmonary disorder. It could be because of many things. It could be because of genetics. You've been exposed to certain pollutants or chemicals.
It's not because I smoke, right?
That could be a contributing factor, but we're gonna go ahead and look at that in the x-ray to see what's going on exactly.
Oh, okay.
Okay? Okay. Do you need anything else before I leave?
No, no.
Okay, perfect, ma'am. Thank you. Okay. Hello, Maricela. So your chest x-ray came back. So it is showing that you do have emphysema.
Okay.
Do you know what emphysema is?
No, it's a bad thing?
Well, emphysema is usually like the air sacs in your lungs. They're damaged, so that's why you're having so much trouble breathing. So because of that, we're gonna go ahead and prescribe some medications. Later on, the respiratory therapists and the pharmacists are gonna come in and explain to you how to take those medications, when you have to take them and such. Okay. And so do you avidly smoke a lot?
Well, not much. Just
Mom,
like
don't lie.
one package a day. But other than that, just I would say there's a minimum.
Oh, okay.
She's been smoking ever since I can remember.
Oh, wow. Because maybe, that might be one of the huge contributing factors to why you're having difficulties breathing. Yeah.
So you're telling me I need to stop smoking?
Or at least maybe start cutting down so we won't be having exacerbations or having difficulties breathing like we did right now. Maybe just cutting it down slowly.
I'm gonna try my best.
Okay. Well, we have to start from somewhere. Okay.
Okay.
Okay, so the respiratory therapist and the pharmacist are gonna come and they're gonna go ahead and explain that
Okay.
medication for you. Do you have any other questions before I leave?
No. Can I go home today?
Well, let's just take a look on how you're doing.
Okay.
And then we'll go from there. Okay, thank you.
Oh,
Hi.
I'm Jessica. I'm the pharmacist. Nice to
Hi,
meet
pleasure to
you.
meet you.
And you are
I'm Andrew. I'm
Jessica?
her son. Yes.
Okay, hi, Miss Maricela. I'm Jessica. Nice to meet you. I'm the pharmacist. So the doctor has prescribed a couple of medications. The first one, we have albuterol. That one is a rescue inhaler. So whenever you feel like you're running out of breath, and all of a sudden you can't breathe for whatever reason, then you take albuterol. And then we have another one. It's called Salmedrol. That one is long acting. And that one is more for like control. So even if you feel better, please continue to take it. It's really important, okay? That you don't stop. You also have a combination of an inhaled corticosteroid and a long-acting bronchodilator. It's super important that you take it as well, okay?
Okay, how many times I'm gonna take those?
Okay, the albuterol, which is a short-acting or your rescue inhaler, you're gonna take it as needed, okay? So whenever you have like a severe, shortness of breath and you feel like you're
Like today when we came in.
Exactly, that one you will be taking. And then also the Solmed, that's gonna be a control. So you take it daily, even if you feel better.
Okay.
Continue to take that one. Okay, it's very
Okay.
important.
Okay.
Any questions?
That makes sense. No, that sounds good.
Okay, the RT is gonna be seeing you in a little bit. Okay.
What's RT?
Respiratory therapist.
Okay, cool.
Yeah. Thank you.
Hello, Mrs. Maricela. Hello, my
Hi.
name is Isabella. I'm the respiratory therapist. So the doctor told me that he found some expanded lung fields in the chest X-ray. So that's probably what's going on with the COPD and everything. For right now, I'm just gonna tell you some teachings because I do understand that you might be going home. You do look better. I'm just gonna take your O2 stat, see how everything's doing. Okay. So the first things first, you need to stop smoking. But I understand that it's. Go ahead.
Like, boom?
Yeah,
Cold turkey?
Yeah.
Oh.
Cold turkey, you
I
can't.
think it's gonna be-
That's
You gotta
what's
do it, Mom.
damaging.
You gotta do it.
That's what's damaging your lungs. So we're gonna need to stop
Can I-
smoking.
Just like 3/4 of the pack?
We could talk to the doctor about maybe like a nicotine patch or something else that can help you, stop smoking. But
But
yeah,
I'm smoking since 13.
I understand, but it's just better for you. It's how you're gonna get better. Another thing is that you want to avoid irritants. So you want to avoid any pollution, some motor vehicle exhaustants. You want to avoid breathing any chemicals or dust. Okay?
So no more dusting.
Yeah, we can't go out on the windy days
Yeah.
here.
Oh, okay.
Exactly. And only use your medication as prescribed. Okay? The pharmacist already talked to you about that, correct?
Yes.
Okay, perfect. And also you want to get your vaccines, the flu vaccines. That's going to help with your pneumonia and everything. Okay?
Okay.
Let's see what else we have. Also for when you're taking your inhalers and your medications, make sure you rinse your mouth with water after the medication, okay? That's gonna help prevent the fungal in your mouth.
Okay.
All right? Do you have
So
any
can I no
questions?
swallow?
Just
Should
rinse.
she swallow it or spit it?
You can spit it out. That's what you want to do. You want to spit it out. And yeah. Okay?
I think her machine's ready.
Yeah. Okay, so I see here that your O2's at 98%. That's really good. So I'm just gonna get the doctor so she can do your discharge, okay?
Okay.
Do you guys have any questions?
No, I think that's good. Thank you.
Okay,
Thanks for getting
no
us home.
problem.
Hello, Miss Marisela.
Hello.
How are you feeling? Are you feeling
I feel
a little more
better.
better? Yeah. Your O2 set your oxygen saturation, and it's at 98%, so we can actually discharge you to go home.
Okay.
Okay. So what did the respiratory therapist tell you? Or?
She said that I'm gonna use an inhaler, rinse my mouth, spit it out. But that one I don't like is just stop smoking because I think it's gonna be so difficult.
I know. I mean, it is going to be difficult since it's been part of your lifestyle, but we do have to make little changes here and there so you could get better. Because if we don't, then it's just going to keep getting worse and worse. And then we're treating it, but I mean, we'll be treating it, but and then you keep smoking. It'll just be like a vicious cycle. Okay.
Like
I
she
mean-
said, let's just start with a few cigarettes and then go to a half a pack and then we'll keep going down. But we have to start somewhere, Mom.
Somewhere we have to start slowly, but you can do it. Okay. I know it's gonna be hard, but luckily you have your son to be helping you. Okay.
Okay. Well,
Okay. So before you leave, we'll go ahead and give you the medications you need, and then these are your discharge papers. And then just remember that COPD is a lifelong condition. Okay. So we have to be
Can
taking.
I go on with no oxygen or I'm gonna take the oxygen?
For right now, no oxygen. Since your oxygen saturations is at 98%, seems like you'll be okay without it. But the medication that I prescribed for you, it should be helping you out. Okay. Okay. These are your discharge papers. Do you have any
Thank
questions for me or any concerns?
No. Thank you very
Okay.
much.
Perfect. So I'll go ahead and let the nurse know, and then we'll take it from there. Okay.
Okay,
Thank
thank
you.
you.